Let's get oral. Let's get oral.
Oh, we're live. We are officially live.
Oh my gosh, let's get oral on this probiotic thing that's happening. I feel like probiotics have been, I don't know, up and coming for a long time, but now that they just seem to be gaining so much steam. I know you're working in this field. Tell me about it.
Yeah, I don't know if I qualify as a pro on probiotics, but spending a few years in this space now as a product developer, I feel like I have some insights to share.
Let's get oral.
I'm sure you do.
But what I love about this, this current blip on Earth's timeline of human existence is how often I'm seeing these featured articles in like Washington Post, New York Times. I'm sure Gawker's got things. Is Gawker still a thing? I'm sure.
Oh, like yeah, right.
Just seeing the amount of attention the microbiome's getting and subsequently probiotic products in their application. So I feel like this is a very appropriate time for us to get nerdy on LGO about these bugs. What are they? Why do people use them? Are they effective?
Yeah, hey, wait. I thought we were trying to get rid of the bacteria in our mouths. Do we need more?
Right.
Do we need more of them?
Yeah, when did this shift happen?
I thought I was going to the dentist to remove the bacteria, but now I want them. I'm going to chew them or something.
Mm-hmm.
What is it?
Yeah. And so I think for today's episode, Camille and I, again, another fun topic for us, but we hope to spend the next 45 plus minutes or so really getting into the weeds and having a more educated and nuanced discussion with regards to not only what probiotics are, but whether or not they truly have as great as utility as maybe the ether seems to suggest right now. And so we're going to first spend some time going over, as you know, the background, and then we'll get into the nitty gritty.
Yeah, tell me about the background. What are probiotics? What are these things?
Yeah, so probiotics are live microorganisms or microbes that provide health benefits. And so the pro being forward or good, and biotics, with using our Latin and Greek terms, being for life. They perform in a variety of ways. They don't all provide the same mechanisms, but generally probiotics do one of a couple things. They either actively or indirectly, quote unquote, fight, I'm doing air quotes now, compete with the bad microbes, whether it's the bad bacteria or fungi. Another function they provide is they also can aid or directly contribute to our metabolism and how we digest our foods. And this can then subsequently be linked to being able to reduce the risk of various GI or various other bodily and physiological issues and functions that we experience. So the short-term version is probiotics are essentially supposed to be considered just good bugs that we can consume and use. They are typically designed and delivered as dietary supplements. And at least here in the United States, dietary supplements, they, quite frankly, and put it, they're wild, wild west out here. They can come in many, many shapes or form with relatively little oversight on the regulatory end. And that's not to say there's not great brands.
I mean, the FDA tried to do a little bit of work on this. I can't remember when they got GRAS status, but quite a few years ago, the FDA gave probiotics GRAS status, which is generally recognized as safe. And this pushes them into the supplement space. So pretty much any manufacturer can throw some probiotics at us and feel good about it because generally we think of them as safe. And unfortunately, since that status was given, we've come to find that there are some risks, and we'll talk about those in a little bit. I would say that generally they are safe. But just like our microbiome, sometimes it's problematic. And so it's kind of unsurprising that there's some risk involved here. But I think that as long as we're aware of the risks and kind of understand what the potential risks are, then we can perhaps navigate this space more thoughtfully. But anyway, there are
Exactly.
so many pieces of the probiotic story. A lot of terminology gets thrown around. So let's talk about some of these terms. So there's probiotics, which you just told us are these good microbes that provide health benefits. But there are also prebiotics, postbiotics, and terms like dysbiosis and homeostasis. So you want to take us through
Yes.
what a prebiotic is?
Yes. And so getting back to our Latin and Greek roots and terms, a prebiotic is a non-digestible food ingredient that promotes the growth of beneficial microorganisms and microbes. So it's not uncommon for some of these supplements or products we're talking about to be formulated both with probiotics and prebiotics. But you also can find supplements that are formulated with prebiotics only that are designed to promote the good bugs that we have in or on our body. And so this can come into form, for example, as an HMO or a human milk oligosaccharide that's paired with strains such as bifido that are able to break down those milk sugars into other short chain fatty acids. This could be right or other like forms of tapioca starch or whatnot, which could also be used as stabilizers in formulations. So prebiotics come
What
in a
about
variety.
fiber? I hear a lot of fiber gets thrown into a prebiotic formula.
Yes, various fibers are also popular types of
I mean,
prebiotics.
would you think that fiber as a prebiotic would be good for the oral cavity or just the gut?
That's a great question. I would, my initial speculation would say more so for the gut, because that fibers typically are things that are going to be digested, at the latter half of our digestive tract. And just thinking about the role of like nutritional uptake and utility throughout that, our biological process, being able to provide fibers in an oral focused or designed probiotic, it would have less efficacy and like function since the bugs up there. It's just such a dynamic environment between like the teeth and mouth. We're talking. There's just a lot of activity going on, and we're persistently swallowing. At least some of us. So,
yeah, I think the prebiotics for the mouth will look a lot different than the prebiotics for the gut. I mean, just inherently, there are two very different types of microbiome communities happening there, and so. What a good prebiotic looks like for the gut, I think will just be very gut specific. And do we have prebiotics in the oral space yet?
Well, I don't want to say no. Like none are coming off the top of my head that are like special by any means, right? But like even if we get into like your like not saying like xylitol, sucralose, some of those non-nutritive sugars we talked about or whatnot, but they still play a role with convincing people to take them. I just flavorant too.
Yeah, sure. Yeah, a tasteability,
right?
Taste.
And so like, is that a prebiotic? Because if it helps someone to at least take the product that does have a probiotic that could help the growth of other bugs, then yeah, I'd consider it a prebiotic. For
the xylitol thing, I know a lot of people have thought of it as a prebiotic. I think that there's evidence that it's not necessarily a prebiotic, but does it provide some benefit? Probably, definitely, as long as it's not sugar.
Yeah.
Better off.
Right.
Okay, so I got what a prebiotic is. It basically feeds the good bugs. A
Mm-hmm.
probiotic is a good bug. And what's a postbiotic?
Yeah. And so throwing in one more term here, and it sounds similar, but is definitely different in nature. And so, unlike a prebiotic or a probiotic, a postbiotic is essentially the leftovers or the quote unquote waste that is an output from the probiotics that we were just previously talking about. So,
Could this be a good thing or a bad thing?
it could be a good thing. It's you generally chat it about as a good thing, but this could also be a bad thing. And so I think this kind of gets back to what you're alluding to earlier about some of the risks that aren't typically talked about that could arise from improper probiotic use, whether it's targeting the wrong population or the wrong formulation and through application. So while generally postbiotics, I feel like is not talked about, or I don't want to say it's not studied, but it's just not chatted about as not, because again, since probiotics here in the States tend to have the GRAS status, that tends to provide some cover for brands of people to not do as extensive of studies to understand what is happening after the fact on a longitudinal scale.
Yeah. Yeah. Okay, so we have probiotics, good bacteria, prebiotics, things that feed the good bacteria, and then postbiotics, the waste from a good bacteria that could be beneficial or not.
Mm-hmm.
And then we have the terms dysbiosis and homeostasis, which are kind of lending to the community aspect. So what's dysbiosis? What does that mean?
Yeah, and so the short version, dysbiosis is generally understood to be the imbalance of microorganisms or types of microorganisms present in one's flora. This could be talking about it in a whole body way, but we tend to talk about it from a site or organ specific manner. So there could be dysbiosis of the mouth, for example, or dysbiosis of your lower GI tract, maybe dysbiosis of your skin. But generally, we tend to talk about dysbiosis in a gut-centric manner, and alluding to how the imbalance is then linked or contributing to various ailments that are experienced by that patient or the individual, whether it could be just persistent bloating or discomfort and other common GI ailments we experience, to those that could be a bit more serious. And I don't want to say life-threatening, but like hindering to quality of life. And so a lot of the studies that have been focused on understanding the flora and the microbiome over the last 15 years or so have been interested in understanding really like which bugs or pathogens are commonly associated with, say, gut dysbiosis and leading to their respective overgrowth. And then what are the factors that contribute to that dysbiosis?
Or the ill health, right?
Or the ill health.
Because
Right.
sometimes you don't know if it's the overgrowth that is causing the ailment, or is that overgrowth a symptom of the ailment? Yeah. So it's it's a tricky question that
it is
hard to suss out clinically. Yeah.
It really is. And I think both the definition for dysbiosis and its companion term, homeostasis, here, meaning having some relative state of equilibrium between the microflora or the microorganisms and the host in its body, whether we talk about it in a site-specific way, again, such as the mouth or the gut. And again, I think this traditional definition I just provided of homeostasis is not as clear when we really do talk about the microbiome and this topic of probiotics, because it's so dynamic, right? You have so many factors and variables from our day to day and the subjectness of each of us individuals to say like, this is normal and this is your equilibrium. Like, what does that really mean over time?
Right. I think that every oral health practitioner can appreciate the fact that we all are supposed to be sleeping with our mouths closed, and during that time there's less salivary flow and there is a closed oxygen environment, so our whole ecosystem in our mouth changes considerably, such that when we wake up in the morning we have a whole new microbiome as opposed to when we went to bed. So, what is homeostasis exactly? It's just that I don't have any pathology, maybe.
Yeah, right. Things look good.
I think that's
Sound
where,
good.
yeah, we have good pockets and taut gingival tissue,
Hmm.
and we're feeling good, and there's no bleeding on probing.
Yeah.
Anyway,
So,
yeah. So now that we have the technology or the technical terms out of the way, we have probiotics are good bugs, the prebiotics that feed the good bugs, and the postbiotics are the leftover waste material that could be good or bad. And dysbiosis, ill health community of bacteria. Is it the community that's causing the disease or a result of the disease? It could be dependent on the disease. Um, and then there's homeostasis. That's basically your microbiota with no ill health.
yeah.
That's how I'm going to take it anyway.
Yeah. Yeah. And with those terms, I do think, again, one of the key questions we wanted to tackle in this pod and have um, continue having a conversation on is, are probiotics good or effective at either addressing and correcting dysbiosis and or contributing / maintaining homeostasis? Right?
Yeah. So I think that there have been quite a lot of study in the oral cavity with probiotic strains, and so we're going to walk through a few of those. Not all of them, because there are many. But I think that we wanted to give a little bit of airtime to the nuance of clinical study, and knowing because they are considered GRAS by the FDA, they are typically not going for an FDA claim, which would require an FDA clinical trial, which has a lot of oversight and a lot of attention to detail and attention to statistics. Many of these studies are just not as rigorous. And so we can get a feel good for some sort of impact to our oral health potentially. But the numbers are typically very low in the participants. There isn't necessarily a safety measure, which is a weakness, but it's because they're considered GRAS, generally recognized as safe. And so some of these kind of deep dives are just not done for probiotics unless they're going for a claim. And I'm excited because there are many probiotics that are being evaluated for claims with FDA clinical study. And that is a hot area of research that I'm very much looking forward to following. So let's see, what formats do we typically take these probiotics in that are available in market?
Yeah. So whether we're talking about oral specific probiotics or probiotics for the gut, the formats they typically will come in are either lozenges or like throat lozenges, chewing gums, mouth rinses, and occasionally you'll find the probiotic toothpaste. And as you can imagine, some of these have pros and cons. But what I think about having each of these available that's nice is, depending on the intended user, some of these may be more convenient than the others. For example, I love gum, but because I love gum, I have to regulate my gum usage, because if I have gum in my mouth, I will just chew all day, every day, and end up with a sore mouth. But that might be the best delivery format for probiotics that are addressing, say, halitosis, or for trying to promote anti like biofilm capabilities for certain pathobiotes. And so some of the big brands.
Did you just introduce another term?
I'm sorry. For a bad bug.
There we go.
For another bad bug. When it comes to a lot of these studies, you'll probably see more tablets and or rinses, just due to those being such common formats, and also reproducibility to produce those products, and having the dosing being tight. And then another thing that does have to be considered for not these formats is also its stability, right? Because a lot of these products are something that are probably sitting on a shelf for a long time.
I happen to be intimate with like the how you manufacture toothpaste is very tricky if you're looking to do a probiotic, because you don't want a contamination growing in your toothpaste vial for months on end. And so that's tricky. I would prefer personally, just knowing the manufacturing process behind most of these items, I would prefer, a lozenge or a bite or a gum, or maybe even a rinse or a serum. All of those feel much more appealing to me than a tube of toothpaste that I hope isn't growing anything. That's all I have to say about that. That's a personal preference, though. Like, I just know too much, and maybe I should know less.
But I think the big gist is, for those who are interested in exploring or trying different probiotics, like it's, we're getting to approach the Willy Wonka status, where it comes in many ways, shapes, and forms. But there's probably something out there that works for you, format-wise.
Possibly.
Now, the next question is, how do they work, and do they actually work?
Wait, but what do I want to work on? Am I working on cavities? Am I working on breath? Am I working on my gingival health? There's so many opportunities here. I think that we did a deep dive. We made a spreadsheet. It's pretty involved. There's no reason to go through all the nuance, but I would say that broadly, we looked at all of the different brands, maybe not all of them, but a lot of them, and categorized, which probiotic was in what, and it is a variable. We did feel good that all of the strains involved and being utilized have been tested in the oral cavity in some clinical way. The strength of that study or of those studies are very variable. And so we'll talk a little bit about some of them, but feel good in that all of the probiotics that we evaluated did have some clinical study. Now, the only caveat to that is that once the probiotic being made, it's usually a variety of different probiotic strains, mashed up together and given in a tablet or whatever. While all of those individually have been evaluated, that full formula may or may not have been evaluated. And so, again, I'm not going to go through all of the supplements in the space, but we don't know exactly how that combination will work out clinically. But I think that a lot of these companies are trying to be comprehensive in their ability to knock down halitosis, improve all measures of oral health. So kind of bedeckling each formula with a little bit of everything to hopefully improve your mouth. So I think I tend to want to go with supplements that actually focus on the oral health science. So some, supplements are just kind of jumping on the bandwagon. They take the predicted strains and make a tablet or whatever. But the companies that are really actually focused on oral health, just holistically, that's kind of who I trend towards. So, yeah.
So what does stand out from our research, and just if you were to take all the products and kind of put them on a table and look at their labels, you'll notice that the series of strains that make up these probiotics fall into 3 buckets of genera. They're either coming from the lactobacilli, the streptococci, or their bifidobacterium. species. And a lot of these formulations use one or a combination of species from these buckets that have been tested in a variety of different stories to be effective with either reducing scores and outputs for measuring carries, or being able to reduce inflammation and or bad bugs affiliated with perio. We'll also acknowledge a study that looked at the application of somebody's strains in a mouth rinse or tablet form / lozenge for addressing halitosis. And then there's even been some preliminary studies looking at either strep or lactobacilli for potentially addressing thrush or oral candidiasis, which is a fungal overgrowth in the mouth. So first,
let's be clear that Candida is part of the normal flora in homeostasis. So let's not banish all Candida, but definitely overgrowth in the mouth and throat can be terrible.
Mm-hmm. And so we'll, while we go through these buckets, we're going to tackle first addressing a study or two, looking at probiotics used in a caries clinical. Then we'll follow that with looking at some probiotics found or evaluated in perio clinicals, followed by bad breath. And so first, I'll tackle the dental caries one. One of the more recent studies of the last 10 years that was done was evaluating a blend of Lactobacillus salivarius tablets that were used in a 64-person study. And what they saw, or what they were interested in seeing, is if the application and use of these tablets over the course of 2 weeks could reduce the risk of tooth decay. And some of the things that stood out from the design and outputs of the study that we liked was, they looked at more than just one strain. They're looking at multiple salivarius strains and to be able to compare their respective efficacy and performance. And they also did that study with what I think is an appropriate positive control by using a specific antibody against a glucotransferase, or a GTF, that is produced by Streptococcus mutans, which is one of the primary quote unquote bag bugs responsible or given credit for causing and persisting dental caries in the mouth. And then they also use another, I think, appropriate negative control using xylitol for dosing purposes, since it has been postulated as a prebiotic. However, some of the weaknesses from this study that stood out to us was just low numbers used in each group. Again, this was only a study containing 64 volunteers, but those 64 are broken up into your controls and test groups. And since we had multiple strains, it became to being a low in number for an amount of users tested in those test groups. And there also was no caries or clinical evaluation done post-study. So after 2 weeks, bam, it was a matter of data collection and reporting without being able to do any clinical evaluations. And there was no also hygiene control.
Right. So that's something. Well, okay. So the positive is that they used non-subjective measures, which I always appreciate. Mm-hmm. So they did count the number of streptococcal mutans that were present before and after treatment, and the salivary buffering capacity, which we know can be a measure of risk for caries. So mm-hmm. those two measures were in favor of the probiotic being used for 2 weeks. The hygiene control is something that doesn't get a lot of airtime, and I love to triple down on this issue. First of all, there's no washout. So everybody's using their own hygiene product. Are they using a therapeutic? Are they using what? Mm-hmm. Who knows? Are they using anything? I'm not sure. If I give them something and they all are using the same thing, then I've at least controlled that additional thing that goes in their mouth twice a day, as well as that probiotic or placebo. So this is something that I like to discuss, because you can get quite a bit of variability depending on what hygiene product they are using. And with a low N as 16 per group in this study, I think that was a mistake to not have a washout or hygiene control. But I love that they did the study, that they're really looking and putting in these solid controls. So those were great. But again, that's just one study.
Yeah.
There have been quite a few, both better and worse.
Mm-hmm. And I'll note for the listeners, the description or note section for this pod will make sure to link each of these studies that we're talking about, where we got our data to do due diligence for evaluating and critiquing them accordingly. Because again, I think there's some exciting stuff in here, and I hope some of you all become pros about probiotics too.
Yeah, but also being like just pragmatic about what the clinical studies are actually looking at. The prevention of perio, that both of these studies, they're going in with clinicians that are evaluating pocket depth, GI, which is gingival inflammation, and bleeding on probing typically. And the first study is Lactobacillus plantarum L137 in a capsule form. And they're looking to see if they can reduce pocket depth in patients that are also undergoing supportive periotherapy. So they're getting intervention, absolutely. They do employ a true placebo. They do have periopathology at the beginning of the trial, and they do a 12-week intervention, which is significant. But again, this is also a low-numbered study, so it ended up being 20 people per group. Still better than, 10. And there's also no follow-up. After that kind of primary endpoint of 12 weeks, you've been on the probiotic, I'm going to measure all your pocket depths, what have you.
Mm-hmm.
They don't take it beyond that. So how long does that treatment effect last, or that probiotic effect last? We don't know. Does it endure? And if so, for how long? So how long do I have to take these probiotics? My whole life? I mean, I just want to know so that I can treat myself accordingly. And if I run out, should I be worried?
Right.
Or if my manufacturer changes strains, should I care? Anyway, so those are things that I think about. The next study is another lactobacilli strain with a bifido combination lozenge, and this was looking at anti-gingival and biofilm effects. So reduction in gingival inflammation, looking at the plaque index with clinical evaluation. So this was a 50-50 per group, nice numbers. They had a true placebo, and over 80% of the participants had mild gingival inflammation. This was actually done in adolescents. I think it was 13 to 15-year-old boys. They underwent a month of treatment. And again, no follow-up. So once they've had that 1 month treatment, they go in for evaluation, and there's no understanding of how long this treatment effect might last, but they did not have a change in any gingival inflammation or plaque index, but they did see a reduction of F-nucleatum and actinomycetocommittins in the plaque and saliva. So I think that this is exciting. The weakness for me was that, again, they didn't have a control hygiene product. They didn't have a washout. And with the lower F-nucleatum, we discussed in our nitric oxide podcast that F-nucleatum is actually beneficial in bringing together those nitrogen reduction bacterial species that are important for heart health. And so I would have liked to have seen a nitrate evaluation in this clinical, just out of curiosity. It would be a great follow-up study to see. I don't know that I should be worried or not, but I'm just now curious.
Yeah.
But those are my 2 cents on that study.
Nice. And then pivoting from perio, I'm going to briefly chat about a couple studies in the halitosis, or the bad breath space.
Smell my breath.
My favorite. It's a similar thing. There's been several, particularly lactobacilli strains, that have been evaluated for their ability to reduce either the population of bacteria known to contribute to bad breath, and or their ability just to reduce the, let's say, production of volatile sulfur compounds and gases responsible for it. In 2014, there is a report on these lactobacillus salivarius tablets that that did show an ability to control bad breath. However, the evaluation done to this study looked at both organoleptic measurements, which is essentially humans using their nose and smelling and giving a score accordingly, which, is effective but has its own limitations. And then there's also,
how would you like that to be your job, just smelling somebody's breath and saying that's strong? Or
you know what, like that's a great question, because like I recoil at first, but I feel like if you pair it with I don't know, like I get to eat Michelin rated food to pair and balance
Michelin
out.
rated mouth.
Yeah, like if it's, you're saying I got a Michelin rated palate and it's like I get to smell and eat the good with also smell the bad, you know, I might consider it.
Just for the record, there are plenty of products with zinc in oral care, and zinc is known to just drop down those volatile sulfur compounds on contact. Just putting that out there. Zinc.
And so does that suggest, I wonder how many bad breath probiotic formulations contain zinc?
Oh, that's a great question. Didn't even think to ask.
And if they've been put to the test against other probiotic malnourishments designed to tackle bad breath without the zinc. I'd be curious to see what such a study or test would look like. We're so bad.
I know.
This.
Sorry, I distracted.
No, you're good.
Zinc, sorry.
You're good. Back to that 2014 clinical study. So yes, they were looking at salivarius tablets. Some of the strength from this particular study was it was a crossover. It also had a true placebo, and they were evaluating both organoleptic and volatile sulfur VSC scores. And in addition to that, while it was not a perio study, they did measure pocket depth. So it was nice for them to have that other evaluation criteria to look at. They did determine that, similar to the study Camille was talking about earlier, on the perio side, there was a reduction in the F-nuke carriage. However, the implications for that is, I still think, TBD. And then, unfortunately, though, this study also was low in number. I think it was 13 per group. So similarly, just having a very low N number. And there also was no follow-up or standardized treatment plan. So I think you're noticing a common theme as we've looked at the different buckets, whether it's for caries, bad breath, or perio, is while there are some outputs that can lead to discussions on efficacy or performance to some degree, there's just not enough numbers or numbers both when it comes to number of volunteers/patients. Also, there's just not enough time for how long these studies perform or the duration, I think, to be able to make as strong as claims as some would like to make when it comes to the efficacy of probiotics for addressing these oral ailments. Would you agree or disagree or challenge that?
Yeah. So, I wouldn't challenge that at all. I think there was a meta-analysis of probiotics in general, just looking at the critiquing the clinical study itself, how these clinicals are done. And what they're showing in that meta-analysis is there's a high risk for bias, and often there are measures withheld, i.e. not published, and that would be incomplete reporting. The study design isn't always amazing. And so like the not having a washout or, a hygiene control product. These are things that make a great study, really controlling all of these kind of back end potential influences. So, there's a lot of room for improvement here. And again, because we're seeing some dedication to FDA regulated trials to get some of these claims moving forward, I hope that it will improve our understanding of probiotics in general, both the risks and the efficacy. I think I'm definitely looking forward to it. I think there is a lot of interesting data to kind of look through, but there's also, other opportunities that we may not be paying as much attention to, other areas that we could investigate. Or do you want to talk about Candida real quick?
I'll just give a quick statement that there are also have been some studies looking at the potential use of probiotics for preventing or treating oral fungal infections. That is a topic that I've had particular interest in coming out of a Candida lab, working on understanding the oral microflora and which strains in particular has either, I don't want to say an antagonistic, but either like a mutualistic and sometimes antagonistic relationship in various biofilm models on the tongue and mouth. So TBD, we might just have a Candida episode in the future so that Camille can allow me to go buck wild on my nerdiness.
Yes, let's do that.
Yeah,
we
but
should definitely showcase that.
Right. But unlike the caries or period bad breath side, there's just not near as much work done in that space or that bucket just yet. But I still think there should be more to come from this decade.
Yeah. Speaking of other areas to investigate. So I think the critical thing for current studies is to really have a longitudinal study. I don't necessarily think it needs to be taken out to a year, but like at least a month out from treatment, just to see if there's
some follow-up,
an enduring effect, or if we just know that we have to deploy probiotics for a potential benefit just ongoing. And those are questions that remain. And then the prebiotic opportunity, I think, is huge, because in our interview with Purnima, our first episode, she talked about the fact that we all have a unique microbial fingerprint, and the use of probiotics in her mind was probably not the best use of treatment opportunity, because what makes homeostasis in my mouth might be very different than what makes homeostasis in your mouth. And so broadly saying this probiotic is going to take us both to a healthier direction might be misled. And so I think if we understood the metabolic functions of our oral microbiome and what nutrients they need to be in homeostasis, I think that might be an exciting opportunity to improve the space overall, to really tailor our own unique flora to our best homeostasis case. So I look forward to more work in that direction, because while we have generally thought of probiotics as safe, they do come with a bit of risk. And so I wanted to say that the FAO and WHO have come out with kind of more enhanced guidelines on probiotic evaluation, because they have noted that you can get systemic infections, deleterious metabolic activities, which means potentially put you at risk, and potentially excessive immune stimulation in susceptible people, and potentially gene transfer. So many of these probiotic strains often have genes that are antibiotic resistance genes, and those can be transferred to your flora very easily. And so there is a safety issue with creating too much antibiotic resistance in our natural flora. So those are some risks. One of the pieces that shaped my early lab life, I was at the bench working at a fungal lab, predominantly Aspergillus, but we did also look at other Saccharomyces, Candida, all sorts of fungal infections. Our primary concern was with patients that were undergoing bone marrow transplant. And so you have to shut down their immune system. It's very risky. And about 10% of these patients succumb to a fungal infection that is pretty terrible. And that was my first lab. And one of the investigations that we were doing was a patient who was prepping for a transplant operation, and they were overcome with a Saccharomyces infection. So we were given the patient blood to evaluate the strain because it was suspected that the probiotics that their partner was taking had been the issue or the infection source. And so right then, I started to look at probiotics with a little bit more concern, because even back then, and that was like 100 years ago, okay, maybe not 100, but a while ago, certainly not to where we are now, but it created some doubts of safety in my mind as a scientist. And since then, there has been a lot of critical review on the safety and kind of safety risk assessment for probiotics in general. So we have noticed, and it's been written on extensively, that you can get sepsis. You can have some pretty huge infections that arise from these probiotics, but oftentimes in an immune compromised setting. So if you know you're immune compromised, be cautious. I will say one extra thing here, in that one of the other areas of research in my fungal lab was evaluating environmental strains of Cryptococcus gattii. And the reason I bring this up is because a lot of these strains are in our environment and they don't cause us any problems. We breathe them to a moderate degree, and it's not an issue. But occasionally it is. And so evaluating why this one person became ill with a fungal infection, we realized that it wasn't a pathogenic fungal infection. It was an IgE hereditary genetic disorder that she didn't even know she had. But she became extraordinarily susceptible to this one type of yeast. And so it's these unknown variables that cause me to be just very cautious of how we deploy some of these treatments. So that's just a side note. I would say, by and large, most of these are safe. But we do have to kind of consider these potential risks. And I think the more we understand the risks, the safer it becomes.
Agreed. No, those are definitely like good insights, and it's important to have a pragmatic and complete picture when we are evaluating something such as probiotics due to its GRAS status here in the States, right?
Yeah. So let's see, we've talked about probiotics, prebiotics, postbiotics. So I wanted to bring up postbiotics one more time because Glogauer had mentioned on our interview pod that he was looking at a possible probiotic. It is another Streptococcus salivarius, but it is a very specific strain and not one that everybody has. So most of us have some sort of Strep salivarius strain within us, but he identified this very specific substrain that secretes, he calls it Sally 10. Sally 10. And it's basically a postbiotic that is protective and has antimicrobial activity that kills only the kind of potential periopathogens, but is safe for all the other oral microbes. And so he is looking at this strain as a potential probiotic. But I'm hoping that he is also looking at the Sally 10 as a potential postbiotic treatment as well. So I'm excited to see what he does. He has gotten written up for this, so hopefully he'll come out with this and his inflammation assay, and we'll all be getting creative on how to deploy these exciting therapeutics. I also am looking at Bristle with their new probiotic and their salivary diagnostics. So I'd love to see if they're collecting data on the improvements seen from their probiotic in their salivary diagnostic? I'm sure they are. I'm excited to see that data. I'm sure they are too.
Right.
Anyway, I'm looking forward to a lot of work here, and I think that we'll see the results of all of this stuff very soon. I'm excited.
Yes, this category, the field of probiotics and prebiotics supplementation, I think it's a great time to be alive, especially now that, as you were talking about earlier, now that metabolomics is more pervasive and becoming more accessible as its cost goes down. Using that in conjunction with more longitudinal clinical studies, I think could really lead to getting to a future where personalized health and medicine is that much more advantageous and feasible.
Yeah, over-the-counter personalized medicine. I am loving this direction.
Well, as always, thank you again for meeting up with me on this beautiful Friday morning on this end. I hope it's nice over there on the East Coast.
It is. It's summer. It is a little hazy out and very humid, but it is a lovely day. Not too hot yet.
Love it.
Not like
Love
Texas. Oh.
No. I feel for my Texas peeps. So please,
Yeah.
if you, if the weather's nice, I hope you're enjoying nice summer weather. I hope y'all had a good 4th and subsequent weeks ahead this month of July. If it's hella hot, please, I hope you're finding ways to stay cool and comfortable, whether it's in water or in AC or some combination of shelter. Yes. And in the meantime, if there's one thing you can do, if you don't have access to probiotics, hopefully you can at least continue finding a way of eating high fibrous diet in foods.
Well, for the oral cavity, yeah, just avoiding sugar? We already know this.
Avoiding sugar.
And eating all of your cruciferous vegetables to get that nitrogen source, and chew a lot, but eat intermittently.
Exactly.
I think that's our messaging. It just continues.
Exactly.
Anyway, thank you so much.
Of course. This is always a pleasure, Camille.
Loves you alls and your mouth too.
Until next time, keep smiling, everyone.
Let's get oral.
Hey there, listener. If you made it this far, we want to genuinely thank you for listening to Let's Get Oral and giving us a chance. If you haven't already, please subscribe to this podcast on your favorite streaming platform, leave a review on Apple Podcasts, Spotify, or anywhere else, and please share this widely with your friends, family, and coworkers. And if you haven't listened to our previous episodes, we highly recommend you check some of those in our catalog, such as the one we most recently published with Dr. Jonathan focus on the role aging and oral health play with each other. Until next time, keep smiling.